So I've got to say, as a co-health person who's worked with Croakey in organising today, I don't think I expected it to be as amazing as it's been. It's been a fantastic walk and exercise, I think. Thinking about all the things we've seen in the conversations that we've had, what really stands out to me is that community knows the solutions, actually. We've seen so many fantastic services, so many small things and large things, and that real sense of community, and so many great initiatives that either directly help improve people's health or that contribute to people's well-being through ensuring there's good housing, ensuring there's access to gyms, that real sense of social connectedness. So community knows the answers. There's the services that are there, the drug services that we saw were fantastic, the work that Vacho does. Actually, what we just need is government to have the same will, the same commitment that community does, and to fund those things and to take them to scale and to keep making sure they stay strong and grow. So I think as I see the election kind of campaign coming to an end, what I hope is that government sees the strength and the amazingness that exists in the sector already and continues to help, kind of keep that strong and fund it. Because there's so much awesome things happening. And I think probably some awesome things that might come out of today too, because there's been lots of really great conversations between people. And out of those conversations, often kind of new things can grow and germinate and go from there.
Thank you, Aaron. Can you just say where we are at the moment and then take us around, and perhaps we'll farewell those who are still with us?
Yeah, for sure. And I think it's fantastic. We began at Vacho, which of course is an amazing service, and we're ending now at a memorial to the stolen generations, which unfortunately I guess it reminds us both of how terrible government policy can be, but that hopefully, given enough time, we can eventually get it right and recognise when we've gotten it wrong. But obviously that the consequences of that can kind of play out for a long time, so let's not do those kinds of horrible things again that we often do. And I think meeting folks here coincidentally to talk about the amazing legacy of Aboriginal activism in this state's been really awesome too.
Fantastic. Would you
Other
like
folks,
to come along?
I need to walk this way.
Okay.
Reflections?
To me. Hello, I'm Ben Gorry. I'm the president of CATSANAM, which is the peak professional body for Aboriginal and Torres Strait Islander nursing and midwifery in Australia. It's been a real pleasure to come along today. We've got two great supporters of Aboriginal and Torres Strait Islander health. We've got the Croakey team and the blog and the website and all the social media impressions that are constantly put out there regarding health. We've also got the co-health team as well, though. Despite not being an Aboriginal and Torres Strait Islander community-controlled health organisation, what they're doing for our people are brilliant. It was really nice going along to the services today, seeing the buildings, hearing about the stories, and even particular, it's just that one little thing that really stuck with me about the co-health locations, that it's actually a really welcoming environment for our Aboriginal people here in our inner city areas. So there's little things like that really go a long way to making that health equity and the right people receiving the right services, in particular Aboriginal and Torres Strait Islander people.
Thank you.
So I want to thank everyone for today, and it's been really nice to participate and go along with it.
And thanks for your fantastic tweeting all along.
Okay, cheers, thank you.
Okay. Move.
My name's Joshua Pearce. I'm a CATSANAM board member. I think I'm reflecting on today, right? The thing that I was thinking about beforehand was the different places we've been to, and then after seeing Uncle Boydie give that talk, it just gives me hope, that we're still fighting for what we need and what we want. And after 80 years, we're not going to go away. And hopefully in 80 years, we're not going to be saying that we're still fighting for closing the gap. Hopefully they're listening today and we make a move today, not in 80 years.
Fantastic. Thank you very much.
Hi, I'm Tony McBride. I was really struck today by, it was another example of the complexity of how communities work, the diversity of people in a community. Not everyone is kind of vanilla, and health services aren't just about providing clinical services. Really importantly, community health does provide service in the context of people's lives, and we got a touch of their lives, the history of people and so on as we walk around the streets today, the implications of homelessness, the justice issues and so on, and the fact that life is complex and healthcare and broader care needs to take all that into consideration, not just slice it into 6-minute episodes. So I think the richness of that, and hopefully the capacity of community health under pressures by government to deliver in silos to timed episodes of care, that we can resist all that to still provide healthcare, broader well-being care in that context.
Thank you very much, Tony. Tim.
Tim Woodruff from the Doctors Reform Society. I was delighted to catch up with and see people working at the front line, and to see also the commitment that they appear to have for the systemic change that is absolutely essential to make all of the good things that we've seen today be generalised. Victoria has this wonderful community health centre system. It's actually a beacon for Australia, and the rest of Australia needs to get on board quick, smart, but so does the rest of Victoria, because we still have very limited comprehensive primary health care, and these organisations that we've seen today are ones that are going to shine a light on how we can do things so much better.
Thank you so much, Tim. From the Doctors Reform Society. I didn't say at the beginning. Cheers.
I did.
Did you? I'm sorry. I'm just wandering over here.
Oh, gosh.
Paula, my Croakey colleague.
Yeah, hi, I'm Paula O'Connor from Croakey. I run the operations at Croakey, but today I really enjoyed the Croakey Go. Really seeing so many different community groups coming together, and in talking to them, I'm quoting Ben from the Victorian Health Alliance, I think, who said that it was great just to actually be walking on site in the areas that all these community health places are working on, because quite often everyone stays in offices, so to actually be able to be on site, come together, walk, talk and exchange stories, I think it's been really beneficial.
Fantastic.
So,
thank you, Paula. My other Croakey colleague.
Yes. Hello.
Who are you?
I'm Ruth Armstrong, and I've been on many Croakey Goes with Croakey, and this has been the biggest one, and I guess it's brought together a diverse range of people, and with it feels like a lot of connections have been made, and some of them are not things that we intended. But one thing that struck me today is everywhere we went, we were visiting places that at a macro level would be considered to be, wicked problems, the intersection between homelessness, mental health problems and drug and alcohol issues. The issue of communities, poorly resourced communities, and how do they access care. But everywhere we went, we saw solutions and we saw positivity. And I think if only we could translate these micro solutions and these really functional services we've been seeing into macro policy, then we'd really be on a winner.
Beautifully put. Vote 1, Dr. Ruth Armstrong. Now you're going to take me over to Melissa, who is going to say
young
goodbye.
Melissa. Young Melissa.
Melissa Sweet, Croakey. It's the diehard Croakeys at the end.
Okay.
Your takeaways.
Okay. Well, I think I'm just a little bit overwhelmed and mind-blown. It's been incredible. Such a wonderful turn-up, such terrific engagement. Really like to acknowledge Aram and Lynn Morgan at CoHealth for sponsoring it. It's our first sponsored Croakey Go, and I think, it's brought a whole other level of engagement to it, which has been terrific. So much happens on a Croakey Go. It's very hard to process it all quickly, but for me, just the diverse group of people coming forward, I was so delighted that we kicked off at VATCHO, and to have that level of engagement from them. Also, we've had Catsenham board members here, which is terrific, and then at the end, how amazing was that to meet the grandson of the legendary William Cooper. What an immense privilege, and they're telling us that they're going on a big public walk together, so it just seemed a perfect day to wrap up. So what's my takeaway? I guess it is engage, participate, collaborate, reach out, find new people to work with. Really, I know everyone works in different areas, different topics, but the underlying issues are equity, changing systems. Really, systems are not supporting health equity at present. So how do we collectively, whether we're journalists, whether we're health service providers, whether we're advocates, how do we come together and really hold power to account? Thank you.
Thank you very much.